My name is Cobey Walker and I am 10 years old. I'm in 5th grade at North School. I took the DAPCEP Summer Science Camp. The camp was about the human body systems. In my class, I studied the digestive, nervous, skeletal, musculoskeletal, the respiratory, and the circulatory systems. A project that I worked on during class was dissecting a chicken wing and comparing it to a human arm. From my dissection, I learned that the chicken wing and the arm both have a humerus, a radius, and an ulna. The most challenging project that I did was making a simulation of a lung from a straw, a pop bottle, and a balloon. I solved this problem by working hard to get the balloon to fit on the bottle. My favorite part of the project was seeing how the respiratory system works and simulating a diaphragm with the balloon. If I were to make a video game out of this summer camp experience, it will be named The Man. The object of the game would be to build a superhuman that could perform superhuman stunts, and you could win features for your superhuman to be really cool.
I am Dr. Tisa Johnson Hooper. I'm a senior staff pediatrician at Henry Ford Health. I'm the medical director for our Generational Resilience, Opportunity, and Wellness, or GROW, Center for Autism and Intellectual and Developmental Disabilities. So I wear many hats at Henry Ford Health. I'm a primary care pediatrician for those children with special health care needs, and I'm also the medical director for our GROW Center for Autism and Intellectual Developmental Disabilities. Back in 2008, I started the Center for Autism and Developmental Disabilities in the Department of Pediatrics. This past year, I developed our new program in the Department of Family Medicine, really to be intentional to fill in the gaps that I was seeing in the care for folks with autism. So DAPCEP is important to the healthcare industry because it definitely provides exposure to diverse populations on really the emerging technology and science that we have. And we know when you expose a diverse population, you create and cultivate a diverse workforce. And when you have that diverse workforce, you're more likely to meet the needs of all of our patients. Hopefully we'll then close those healthcare disparities that are so significant today. We will have a workforce that is intended for all people, bringing in broader perspectives. It's really important to start young and to nurture and encourage up, and that is what DAPCEP is doing so beautifully.
Hey, Dr. Johnson, how does the world of medicine differ from what I see on TV?
Cobey, thank you for your question. So how my medical world differs from what you see on TV, the range of things and experiences you can have in healthcare. Typically on TV, you may see the exciting aspect of maybe someone in the emergency room, or you may see a primary care doctor that works with a patient and a family. And all those are great experiences as a healthcare provider, but you probably don't know, as a physician, you could be a teacher. You can teach medical students, residents, or fellows. Those are people at different stages of training of being a doctor. You can be involved in policy within a health system, a hospital, or even on a state level, even nationally. In policies, you're making the rules of how healthcare is going to be carried out. You can be engaged in advocacy. So you are advocating or requesting really vigorously how you want policy to change. As a physician, you can do primary care or specialize in just like one area of the body. You can engage in surgery. There's just so much that you can do as a physician. I think most people just think of one little small aspect. And that's why I love medicine, is because there's so much you can do.
Thank you, DAPCEP, for this award. I'm very glad to win this.
I'd like to thank DAPCEP for this award. The Real McCoy Award is very, very important to me and meaningful. I appreciate the recognition for my life's work. It truly is my purpose, and I appreciate the recognition.